I am Saifi. I'm from ARK Foundation, and I will be the host today for this webinar. And we have S M Abdullah from University of York with us today as the speaker, and he will talk about the extent of illicit tobacco uh, sales and consumption in low and middle income countries. And this is a systematic review and meta-analysis that he did as part of his PhD study at University of York. So, as we already know that the illicit tobacco trade fuels the tobacco epidemic and undermines the control efforts in different countries. However, very little is known about the extent of the illicit tobacco trade in low and middle income countries where more than 80% of tobacco users now live. So therefore, what Abdullah was aimed to do is he systematically reviewed the research on illicit tobacco trade in the context of LMICs. So we would like to know the list of his process and what he found through his systematic review and analysis through today's webinar. So I would like to request S M Abdullah to present his fantastic findings to our esteemed audience today. And we will take questions right after Abdullah finishes his presentation. So over to you.
Yeah.
Thank you.
Thank you, Saifi. Thanks for giving me the opportunity. So, good morning, everyone. This is S M Abdullah. I'm a PhD researcher in the Department of Health Sciences, University of York, and also I'm affiliated with Department of Economics, University of Dhaka, and currently on my study leave. I truly appreciate the opportunity to present the findings of my research work related to estimation of extent of illicit tobacco trade in low and middle income countries. Let me just walk you through what I am going to talk about. So at first, I would like to tell you why this review is needed. Followed by, I will present my review question and what is the eligibility criteria that I have used and the data source that I have used for my research. And I will go through the study selection and data extraction process and a detail on the critical appraisal that I have used for my systematic review. Followed by, I will discuss my synthesis method and the results of my research work. And finally, I will talk about the main findings and discussions. And also, I would like to share the strengths and limitations of my research. And by the way, this systematic review protocol is registered with Prospero under the Center for Research and Dissemination in the University of York. And you can see the link given in the screen. If you're interested, you can go through the protocol as well. So let's begin with why this review is needed. So in 2022, World Health Organization reported global tobacco prevalence at 22.3%, with 80% of its users living in low and middle income countries. So illicit tobacco poses a global challenge, particularly for low and middle income countries, where illicit cigarette consumption is higher. Now, what we already know on this topic, so existing research shows that low and middle income countries has a greater share of illicit tobacco than the high income countries. Till the date, there are two studies which have estimated the share of illicit tobacco. As you can see, that Josens and colleagues used data from the year 2000 to 2008 and used evidence from 54 low and middle income countries around the world and estimated that the share of illicit tobacco would be 12.1%. In recent times, Goodchild and colleagues published the paper in the year 2022, and they have used data from 2010 to 2018 and evidences from 16 low and middle income countries, and found that the share of illicit tobacco in those countries will be 12.30%. These studies had different objectives, and as you can see, that one study is a bit outdated, and the other study included the published evidences till the year 2018. And also, none of the studies were designed as a systematic review, so they didn't collect the literature systematically. And the recent one actually didn't include the evidences published within the few of the evidences published within the study period. So what is not known So obviously, considering the timing of the publication and the inclusiveness of the publication in the study period, we need to know what is the share of illicit tobacco in low and middle income countries in the recent times, and is the share of illicit tobacco in low and middle income countries same across the type of tobacco? Because the previous research didn't differentiate the share depending on the type of the tobacco. And how does the illicit tobacco share differs in low and middle income countries across the method of estimation? So the previous research didn't also differentiate the differentiate the share depending on the method of estimation. So this particular review wants to add value in the literature by providing an updated estimate of illicit tobacco in LMICs using systematic collection of evidences. It also targets to provide estimate of the share of illicit tobacco in LMICs, which will be stratified by method of estimation and will be stratified by the type of tobacco. Now, moving on to the review question, considering the exploratory nature of this particular topic, I have used the perspective framework to formulate the review question and define the eligibility criteria. So there are two particular review questions that I tried to address in my review. The one was the what is the share of illicit tobacco sales and or consumption in the LMICs? And the second question was, what methods were used by studies in LMICs to estimate the share of illicit tobacco? So here, as you can see, that the eligibility criteria, depending on this particular perspective framework that I have used to select my studies, it can be summarized as that all the studies with tobacco control perspective conducted in low and middle income setting during the time period 2012 to 2023 examined the phenomena of illicit tobacco within the environment of sales and consumption and measured its share was eligible for this particular review. And as an exclusion criteria, we decided that all studies conducted in the context of high income countries and published in other languages except English were excluded from the review. So for the data source, what we have done is we developed an exhaustive, comprehensive search strategy with the keywords like tobacco, and that includes both smoking and smokeless, illicit tobacco sales, illicit tobacco consumption, illicit tobacco trade, non-compliant packaging, smuggling, tax evasion, counterfeit, bootlegging, cigarette tax stamp, sticker, excise tax stamp or sticker, and LMICs were the main keywords using which we have developed our search strategy. And particularly, we searched 9 electronic databases and 3 targeted websites, which are actually famous for tobacco-related research reposition. One was the Tobacco Economics, maintained by the University of Illinois at Chicago, and the other 2 was REAP, which is the Research Unit on Economics of Accessible Products, which is maintained by University of Cape Town, South Africa, and WHO FCTC Knowledge Hub on tobacco taxation. So these were the targeted websites we searched. Besides these electronic databases, we also access the reference lists and guided Google search and the gray literature to include to find our relevant literatures. So for the study management software, the review utilized EndNote 20 and Covidence as reference and review management software respectively. And in every stage from screening to the data extraction, there were always 2 reviewers involved, and any kind of disputes were settled through discussion and the intervention of the third reviewer. For data extraction, the Cochrane Effective Practice and Organization Care form was adapted and modified according to the review question. Along with the size of illicit tobacco share, the information that we have the other information that we have extracted from the studies were details like method used to measure it, the study design, the location and timing, the sample size, how the data was collected, the analytical techniques employed, and information about the finding sources. So these are the informations that we have extracted using those data extraction from. For the quality assessment or the critical appraisal of the estimates, since the existing tools lacked both completeness and comprehensiveness to apprise illicit tobacco studies, we used Crombie's iTool and matched it with an established framework suggested by Professor Hannah Ross. And this framework was explained in detail in the methodological textbook for tobacco tax evasion titled Understanding and Measuring Cigarette Tax Avoidance and Evasions, a Methodological Guide. So this particular methodological guide provide guidelines to assess the quality of estimates from tobacco tax evasion studies. So we have used the framework suggested by this methodological guide along with the Crombie's item tool to develop our own critical appraisal for this systematic review. So the evaluation characteristics that we received from that framework was mapped over the 7 domains on which we apprised the included studies. And those domains, as you can see from the screen, were whether the studies were peer reviewed, who actually funded the study, and how much was the replicability and theory relevance of the study, how much was the generalizability and what was the criteria selection for defining the product as illicit, and then a definition and identification of the illicit products, results and cross-validation of the illicit estimate, and whether the study actually acknowledged the limitation or not. And each of these domain were then summarized in 3 different categories of the quality of the estimates, and that can be mentioned as whether the study has low risk of bias or moderate risk of bias or serious risk of bias. And just to present and communicate our critical appraisal with our audience, we have used Robbins iTool for the visual presentation of the assessment. So just to give the audience a clear idea about how these studies were critically appraised, I would like to dig a bit detail on this particular issue. So as you can see from this table that on the left-hand side in the bold format, these are the 7 domains that I have just mentioned that over which I apprised my included studies. And with these 7 domains, there were in total 20 characteristics on which these studies were actually apprised. So as we have mentioned that this methodological framework was used in combination with the Crombie's iTool. So you can see that for each of the characteristics under a single domain, there can be 3 responses, whether that study was satisfying that characteristics, or it was not meeting that characteristics, or the information was unclear or not applicable. So what we have done, if the study were satisfying that characteristics, we provide a weight of 1. If it didn't, we provide the weight of 0, or if the information was unclear, we provided a weight of 0.5. So each particular domain, has a specific weight, and that weight is defined as the, number of criteria in each domain divided by the total number of criteria that we have considered. So the domains, for each domain, we had an individual score. To get that individual score, we tried to, just multiply the number of criteria in the domain with the domain specific weight. And finally, to come up with the, total score for the study, we just, add the individual domain weights that we have received for these studies in over the 7 domains, and we added it up. Just to ease of, explanation, we inflated the measurement with a product of 10. So you can see that the maximum weight, if a study fulfills all the characteristics, could be 36, and the minimum score or weight, if the study doesn't fill any of the characteristics, will be actually equal to 0. So we categorized a included study in the 3 different 3 different groups. One, the study can have serious risk of bias if it has an overall score of 11 or 0. It was characterized having a moderate risk of bias if the score was below 22, and we characterized the estimate as a low risk of bias if the score was above 22. So this was the critical appraisal method that I have used for my included studies to go through the risk of bias assessment. Now, for the synthesis method, I have used quantitative synthesis with meta-analysis. And there was the meta-analysis was stratified by type of tobacco. I mean, I have done the meta-analysis depending on whether the tobacco is smoking or smokeless. And obviously, we also stratified the analysis depending on the funding source. So we have analyzed the independently funded studies separately from the studies where the funding information was undisclosed or the funding came from industry source. And the share of illicit for each subgroup and the overall pooled estimate was presented using a forest plot. There was an expectation of heterogeneity leading to a high R square due to the variation in the illicit tobacco trade, because the study design and the results might vary depending on the location, type of the tobacco, time, and also on the estimation method. So that's why we thought that doing a subgroup analysis will be essential. Additionally, since these illicit tobacco studies most of the time usually designed as an observational one, such as they are based on smokers surveys or retailers surveys and pack analysis, usually they involve large sample sizes, which create tighter confidence interval for their estimates of the share of the illicit tobacco. So because of all these, we were expecting a lot more heterogeneity, and along there can be high value of the R square. So just to explore that, we performed subgroup analysis, and besides normal confidence interval, we also estimated prediction interval for our grand estimation. And we employed a random effect model for the estimate of the illicit tobacco. And finally, to check the publication bias, visually we used funnel plot, and as a statistical test we use Agar and Bake's test of small study effects. Now, moving on to my result part, this shows the Prisma flowchart of the study selection process. So as I have just mentioned that I have searched 9 electronic databases and 3 targeted websites along with the gray literatures. So doing all these literature search with the search strategy, initially we come up with 1592 search results. So after removing the duplicates, there we left with 821 records for title and abstract screening. And after double screening those 821 records, we excluded 728, and we selected 93 evidences for the full text screened and eligibility. So 2 reviewers were involved, and they reviewed the full text of these 93 studies, and 45 studies out of these 93 were excluded for various reasons. Like they had some of them have different findings, some of them had different phenomena. In a couple of the studies we couldn't find the full text, and in some of the studies there were different country categories. And after excluding those 45 studies, we were left with 48 studies which were finally included in our systematic review and meta-analysis. And these 48 studies were used to extract the data for the further analysis. Now, if you try to present these 48 studies, we see, as the world map shows, that from 2012, 2012 is the year when the illicit tobacco protocol was initiated by WHO. So from 2012 to the 2023, in this time period, there were 48 studies provided estimate of the share of illicit tobacco for 39 low and middle income countries across the world. The geographical distribution shows that they're mainly from Asia, followed by Europe, Africa, Latin America, and Oceania. And these studies in terms of their characteristics, if we see what were the characteristics of the studies, depending on what kind of tobacco they have studies, where the funding came from, and what were the particular method they have used, what we can see that out of these 48 studies, 46 studies were focused on smoking tobacco. There was only one study that focused solely on smokeless tobacco, while the other one study focused both smoking and smokeless tobacco. And 41 studies were funded by independently, while 7 studies were funded as undisclosed or industry funded. And in terms of their study study nature, out of these 48, 6 were actually report, and 42 studies were journal article, and 7 studies were multi-country studies. And out of these 7 studies, 5 were actually articles and 2 were reports. So there were 41 studies with individual country specific estimates. In terms of the method for share of illicit tobacco in low and middle income countries and the studies they have applied, we can see that the 33 studies that were included, they have used cigarette pack analysis for their estimation, or pack analysis of the smokeless tobacco for their estimation. There were 13 studies who used a gap analysis to come up with their estimation of illicit tobacco, and only 2 studies actually monitored bilateral export and import, what we usually called trade monitoring, to estimate the illicit trade of tobacco. Now, moving on to the more detail in terms of the method that they have used. So the studies who have used pack analysis, so we can see that independently funded smoking tobacco studies with pack analysis, 21 of them actually surveyed smokers, 4 collected packs directly from the retailers, and there were 9 studies who have collected discarded packs, and these discarded packs actually came from street litter, waste recycle bins, household solid waste, and waste recycle sources. And in terms of the pack source, pack information they have used for their study, 11 studies actually collected the cigarette packs and examined their features directly. 15 studies observed or photographed the last purchased cigarette pack of the smokers, and 12 collected the self-reported pack information from the smokers. And in terms of the definition of the illicit tobacco that they have used for their study, we can see that the 22 studies actually relied on indirect definition of the illicit tobacco, and which was actually pack compliance. So they were depending on the pack non-compliance to categorize the tobacco product as an illicit one. And there were 14 studies who actually employed tax stamp scrutiny to identify the true tax evaded or illicit tobacco products, which is usually considered as a gold standard or direct measure of tax evasion. And there were 10 studies who actually used a threshold price approach. For example, comparing the actual selling price of the tobacco with the minimum legal price to identify whether this particular tobacco was tax evaded or not. None of the undisclosed or industry funded studies actually scrutinized the tax stamp. And 4 of the industry funded studies used pack analysis out of 7, and 2 industry funded studies actually collected discarded cigarette packs, and 2 observed the packs with the smokers. However, none of them scrutinized tax stamp or the threshold method. Moving on to the gap analysis approach, as we can see from the bar chart, that all studies using gap analysis actually relied on the secondary data, and most of them, like 8 of the total studies, compared legal cigarette sales with the estimated total consumption. One study compared estimated consumption to annual legal sales, while another compared annual total consumption and legal imports. And the final one, compared excise tax payment with the due payment. There was not that much evidence related with the trade monitoring approach, but as you can see that the trade monitoring approach has also used, secondary data, and mostly trade discrepancy was measured using the gap between the reported import and export of the tobacco, for the country. So both these methods, trade monitoring and gap analysis, were actually designed as secondary research, as they were using secondary data for their analysis. Now, moving on to the meta-analysis part of my work, as you can see from the first plot in the slide, that the um, overall, share of illicit tobacco that we have estimated from the independently funded studies with smoking tobacco only was 14.4%. So 14.4% was the share of illicit tobacco in the included low and middle income countries, and which studies were actually independently funded, and this estimate was for the smoking tobacco. But when we subgroup the analysis depending on the method of the estimation, we can see that the studies who used pack analysis, we have these evidences from 29 low and middle income countries, and the share of illicit tobacco, overall share of illicit tobacco using pack analysis on those 29 low and middle income countries was 14%. And the studies who used gap analysis, and we had such studies from 8 low and middle income countries, and the overall share of illicit tobacco in those 8 countries was 21.1%. And we had trade monitoring as a method in the 2 low and middle income countries, and the share of overall illicit tobacco was 9.6% using those particular method. And from the forest plot, as you can see that in 6 low and middle income countries, this method shows highly significantly share of illicit trade. For example, in Montenegro, you can see that the share of illicit tobacco was 16.60% with the pack analysis, while the lowest share for the illicit tobacco was in Nepal with the pack analysis with only 0.33%. And the other countries where the share of illicit tobacco was relatively higher is, can be mentioned here is Brazil, where 47% was illicit tobacco, Malaysia 39.7% was illicit tobacco, South Africa 36%, Bosnia and Herzegovina 35%, and in Georgia it was 32%. Notably, out of these 6 countries, 3 of them also reported extremely high rate of illicit smoking tobacco using the gap analysis method as well. For example, in Malaysia, using gap analysis, they have found that 65% was the share of illicit tobacco, while in Brazil and South Africa, this share using gap analysis was 36% and 30% respectively. Now, moving on to the estimation of industry funded studies, as you can see here that the overall share of industry-funded studies of the smoking tobacco for illicit share of tobacco was 13.9%. And when we stratified these undisclosed or industry-funded studies, depending on the method of estimation, we can see that the industry-funded studies who have used pack analysis, we have evidence of such estimation in 3 low and middle income countries only, and the estimation was 15.6%. And with the gap analysis, mostly used by the industry estimates, and the estimate came from 12 low and middle income countries, and the share of illicit tobacco was 14.7% in those low and middle income countries. So that was the scenario of the share of illicit tobacco in the illicit smoking tobacco in the low and middle income countries, depending on the depending on the funding source, and also depending on the method of estimation. Now, moving towards the share of illicit tobacco for the smokeless tobacco, we can see that the evidence is scarce, and we can see that we had only two studies. One was solely designed as a smokeless tobacco, illicit smokeless tobacco studies, and the other one used actually both smoking tobacco and smokeless tobacco. But they have covered only three countries three low and middle income countries in South Asia: Bangladesh, India, and Pakistan. And the overall share of smokeless tobacco in those illicit smokeless tobacco in those three countries was 86.9%. And all these studies actually have used pack analysis. There was no trade monitoring or gap analysis studies designed for measuring illicit smokeless tobacco. Now, moving on to the quality of the estimate. This particular slide shows the overall summary of the critical appraisal that we have performed in our systematic review. So as you can see that we had 11 studies. That means 23% of the studies included had a low risk of bias, and the average score of those studies was actually 25.09. And there were 29 studies, that means 60% of the included studies had a moderate risk of bias with an average score of 17.74. And there was 8 studies, that means 17% of the included studies had a serious risk of bias with an average score of little above 10. And the risk that we have, critically assessed over the studies using 7 specific domains, we can see that the risks were mainly pertained to the 3 domains. One was replicability and the theory relevance. So there was always a problem with the replicability and theory relevance of the studies. And the second one was generalization and the criteria of the study selection. And the third one was result and cross validation of the illicit estimates. So these are the 3 most common domains on which the risks were actually pertained for the studies. So if we move on to the individual assessment of these studies for these risk of assessment, we can see that among 8 studies with the quality of estimate assessed as serious risk of bias, 6 were actually funded by the industry, or the funding information was completely undisclosed. Depending on the method that they have used, we can see that all 11 studies with low risk of bias actually applied pack analysis. And among 13 studies who used gap analysis approach, 11 had a moderate risk of bias in their estimates. And among the 2 studies that applied trade monitoring approach, one had moderate risk of bias, and the other had serious risk of bias in their quality of estimate for illicit share. And most of the studies who were actually funded by the industry, or the funding information was not clear. We have seen that they didn't select their illicit criteria objectively, and most of the time they didn't use multiple method for assessing the product as an illicit one. So these are the main problem with the studies, those who have targeted to measure the illicit tobacco in the low and middle income countries. On the small study effect, as we have mentioned in our method, that we used funnel plot to visualize the small studies effect. So as you can see from the slide, that most of the studies were in the peak of the funnel, which indicates that there is no small studies effect, or there is no symmetric effect. And also this visual impression is reestablished with the statistical test that we have performed. And as you can see that the null of no small study effects in both the agar test and back test couldn't be rejected. So the results were actually free from the small study bias or small study effect. Now, what are the main findings that can be summarized from these statistical numbers? So we can see that the size of the share of illicit tobacco varied across the low and middle income countries. This estimate varied on the type of the tobacco. They varied depending on the method used for the estimation, and also they varied depending on the funding source as well. We have seen that the smoke overall share of illicit tobacco in the low and middle income countries for smoking was 14.4%, while the overall share of smokeless tobacco was more than 6 times, and it stood at around 87% stood at that 87% of the smokeless tobacco in these low and middle income countries were illicit or tax evaded. The most common method that was used in these countries to measure the illicit tobacco was the pack analysis, and it came up with the estimation of 14%. And the second common method was gap analysis, which came up with the estimation of 21.1%. So if we look at the undisclosed or industry-funded studies, the estimated share of illicit smoking tobacco with pack analysis as 15.6%. So the industry funded studies, if we consider the most common method, they actually overestimated the regular method that the independently funded studies also used. They overestimated the share of illicit tobacco using the pack analysis. And if we see that what are the definition, or what are the process through which they have decided whether the tobacco product was tax evaded or not, we can see that only 14 studies scrutinized the tax term and depended on direct measure of tobacco tax evasion, and 16 studies used the recommended multiple method for categorizing the product as an illicit one. That means they were using tax or price information along with the pack compliance for detecting the illicit, and hence deciding whether the product has evaded tax or not. And another information and another finding was that there is a low number of high quality studies. Only 11 studies had low risk of bias in their quality of estimates. So what are the implication of these results? So we can see that there were 48 studies. Those were published during the period 2012 to 2023, and the evidences represent 39 low and middle income countries. Among the independent evidence on the share of, considering the independent evidence on the share of illicit tobacco is lacking in many low and middle income countries, even within the list of signatory low and middle income countries for illicit tobacco trade protocol, the evidence is lacking. Currently, if we look at the total number of signatories of the illicit tobacco protocol, we can see that there were 87 current signatories, and out of that 87 signatory countries of the illicit tobacco protocol, 43 actually fall within the category of low and middle income countries. And of these, we found that only 11 countries have independently funded evidence on the share of illicit tobacco since the inception of the protocol. Thus, the majority of LMIC signatories actually lack evidence for the estimated share of illicit tobacco. Now, depending on the method, as you have mentioned, that the most widely applied method was pack analysis, but this pack analysis method mostly was used, or they were relying on the context specific packaging non-compliance to categorize the product as illicit. That means the studies were mostly utilize the indirect method of estimation for the illicit tobacco. And of the 27 independently funded studies on illicit smoking tobacco in LMICs, only 14 examined the tax terms to detect the tobacco that is both illicit and potentially tax evaded. So there is limited evidence regarding the examination of tax stamp, resulting in lack of robustness in assessing the actual share of tax evasion. And then this could be that there are many low and middle income countries who didn't sign and ratify the illicit tobacco protocol, and they didn't establish the proper track and trace method. So many of these studies, since in those countries there were no excise marker or tobacco tax stamp, so they had no other option using the indirect method to categorize the product as an illicit one. And also, if we look at the study evidence, we can see that the findings are highly skewed towards the smoking tobacco, and specifically in the smoking tobacco, they were highly skewed to the cigarette. So out of 48 included studies, we had only 2 studies that covered the smokeless tobacco, while the use of smokeless tobacco was recorded in 127 countries around the world, and we could find only these kind of illicit smokeless tobacco studies in South Asia, covering only 3 countries: Bangladesh, India, and Pakistan. So it's these illicit tobacco studies are concentrated depending on the type of tobacco towards the smoking one, and even within the smoking one, they're mostly focused on the cigarette. Now, depending, given these discussion here, I would just like to mention about the strengths and the limitations. So we applied a detailed detailed and exhaustive search strategy and explored targeted sources for tobacco research, and the inclusion and exclusion criteria we developed and applied were based on a specific perspective question framework, and the study selection, data extraction, and quality assessment was performed independently by 2 reviewers. For quality assessment of the studies, we applied framework specifically designed to evaluate tobacco tax evasion and the illicit studies, and also we stratified our analysis depending on the method of estimate, depending on the funding and the type of tobacco, and also we performed subgroup analysis as well, depending on the method of estimation. The language restriction might be a limitation for us, but as we can see that we were able to get good number of studies covering the geographical variation. So in conclusion, we can mention that there are many LMICs where the evidence is lacking, and studies mostly relied on cross-sectional design and pack analysis approach, and few of them only scrutinize the tax stamp or excise sticker as a certainty of tax evasion and hence the illicit status. The evidence is mostly concentrated on smoking tobacco, and LMICs need to implement the provision of illicit tobacco trade protocol and install the trace and track system and tax stamp for tobacco products where the evidences are lacking. So besides illicit trade research and conventional smoking, the future research needs to consider the novel tobacco products and smokeless tobacco. So with this conclusion, I would like to stop here, and thank you all for listening me. And if there is any question or queries or concern, I am happy to address. Thank you so much for giving me the time.
Yeah, thank you. Thank you so much for such a nice presentation, and it's an interesting finding, we must say. So we would like to invite the audience. If they have any questions, please, you can write your questions in the chat box, or you can raise your hands and ask the questions to the speakers directly. So the floor is open now.
I think, Saifi, I can see Simon raised his hand.
Thanks, Abdullah, for a really interesting presentation. It was really interesting to see all the different methods of collecting data, of estimating this. I guess my slight concern with a meta-analysis here is that you'd expect such heterogeneity across countries, because it's going to be heavily driven by taxes, other degrees of black market. So I guess how reasonable is it actually to do a meta-analysis of this? Is it better to just sort of present it as a sort of narrative synthesis? I know you've done a random effects model to sort of deal with that heterogeneity, but there's so much going on. So random effects isn't necessarily going to really capture the meaningful differences, I guess. So I guess why did you feel the need? Why did you want to pool across countries, and do you think it's a meaningful estimate?
Yeah, thank you, Simon. And I fully understand your concern, and also I agree with this concern. And as in the original paper and the manuscript, we also acknowledge this limitation, that as you can see, the heterogeneity is really huge. And during the presentation, we also have mentioned that why this heterogeneity can cause, because countries differ in terms of their structure, differ in terms of their laws, in terms of their policies, and also the study designs are different. And obviously, because of all these differences, there might be a huge amount of heterogeneity, which inflates the I-square. And as you have rightly pointed out, that the heterogeneity is still there. So yes, we tried to, under such circumstances, it's, usually what I have seen in the literature that people do, that they try to minimize the heterogeneity and try to, explore the source of the heterogeneity. And the one option that usually people use for that could be, performing the subgroup analysis and, measure the prediction interval. So we have done the same thing. We tried to, perform the subgroup analysis depending on the method of the estimation, because as you can see that the estimates also varies quite a lot depending on the what estimation method they have used. And also, side by side, the regular confidence interval, we estimated the prediction interval as well. But I completely agree with you. There is a whole lot of whole lot of concern depending on the estimates and the heterogeneity, and that's why the final result needs to be considered as considered with caution. And obviously, this is given the complexity of the topic and given the variation that we have observed, this is the best what we can do. Obviously, you can go with the narrative synthesis, and that also we included in our characteristics of the studies, and comparing and contrasting the results in the different studies. But at the same time, doing these considering the random effect model with the prediction interval and subgroup analysis, we tried to estimate the overall share of the illicit tobacco. But obviously, I agree with you. There is concern, and the results needs to be considered with caution. Thank you, Simon.
Yeah, thanks for that. Do you have any idea what are the sort of predictors of higher prevalence of illicit tobacco?
Sorry.
What are the predictors of a higher prevalence of illicit?
Okay, the predictors.
Yeah.
Yeah, so in the main difference, you will see that there are 6-7 countries where the illicit tobacco is extremely high, like over 40-50%. And the main reason is the I would say different people can be coming with different methods, but most of the cases I usually consider, being a tobacco control researcher, I usually consider this problem as a governance one. And one thing I would like to stress upon through this webinar is that since most of the countries, around the world, including high income countries and low income countries, they didn't, sign and ratify the illicit tobacco protocol. So they didn't establish the track and trace method. So obviously loose border control, price differences among the countries, governance problem, and since there is no proper track and trace method, all this can actually cause, high illicit tobacco. And also in our earlier research, we have found that there is definitely something to do with the administrative culture, tax administration, and the rules and regulations. If the enforcement are not proper, definitely this will affect the share of the illicit tobacco in the particular country or the concerned country.
Thank you. That's very clear.
Yeah, thank you.
If any other has any questions.
Saifi, I think there is some question in the chat box.
Okay, no problem. I can deal with that. In countries where smokeless tobacco is not regulated or taxed, is it still labelled as illicit? And how has that been addressed in the studies?
Oh, thank you, Lon. Thanks for rightly pointed out a particular, pertinent issue. As I was mentioning in my presentation, that smokeless tobacco, I would say that you won't find that much illicit smokeless tobacco studies actually. So in our systematic review, using a comprehensive and exhaustive research for from the period 2012 to 2023, we could found only 2 illicit smokeless tobacco research. One was solely focused on smokeless tobacco, and other used both smoking and smokeless, and they have covered only 3 countries: Bangladesh, India, and Pakistan. So as I was mentioning in the presentation, that in most of the countries, not only for the smokeless tobacco, also for the smoking tobacco, in the countries where they don't have data, or they don't have a particular structure to evaluate the product or the true for the true tax evasion status, so they usually depend on the indirect measure of illicit, and that indirect measure usually comes from the pack analysis approach, where they normally try to explore whether the product compliance with the country specific tobacco control law or not. But obviously under that circumstances, there is no way to be sure that whether that product was actually tax evaded or not. So that's one issue. And the other issue is like we every now and then in countries, in the media reports, you will find about the report on cross-border smuggling, but obviously I haven't seen any low and middle income countries who have consistent database where these cross-border smuggling were reported and specifically focused on the smokeless tobacco. So obviously on those cases, what we have seen that in most of the time they usually depend on the indirect measure of the tax evasion for smokeless tobacco and also for smoking tobacco, and they use country specific tobacco control laws to check whether they were maintaining the packaging compliances or not. And the idea or the philosophy behind it is, if the product is not complying with the rules and regulations for the packaging, so it could be that they were produced at low cost so that they can sell at lower price compared to the legislative one, and they can evade the tax. So that's how actually that they do. And the included two studies in our systematic review, we also observed the same thing, that they were actually using the non-compliance of the smokeless tobacco packs because there was no other marker or no other parameter using which they would be able to show whether they were illicit or the tax evaded. Thank you.
Was there any view about how the rate of illicit tobacco is changing over time?
Oh, so like depending on the kind of Seman, if I read you correctly, you were talking about whether there is any trend on the illicit tobacco or that?
Yes.
Oh yeah. Although although the results are not directly comparable, because with to the best of my knowledge, this particular study is the first ever systematic review for the illicit tobacco, for the share of the illicit tobaccos. And previously, two studies actually estimated the share of illicit tobacco, but the literature were not selected systematically, but they estimated a grand share of illicit tobacco as well. So as I were mentioning that using the study from 2000 to 2008, the share of illicit tobacco was around 12.10% in the low and middle income countries, the overall share, not the country specific. And studies using from 2010 to 2018, the share of illicit tobacco was estimated as 12.30%, while the estimate that I have come up with using the studies from 2012 to 2023 was around 14.4%. So this I shouldn't say that these results are directly comparable because the methods are different, but if you want to grasp a idea in a broader sense, these are the three numbers that are in front of us. But obviously there are trends in terms of individual country specific evidences.
Okay, yeah, thank you.
Thank you.
Yeah, thank you so much, Abdullah sir, for your nice presentation today. And thank you everyone and the audience who have able to join today's webinar. So we are looking forward to have you in the next webinar. So see you and thank you so much. Goodbye.
Thank you. Thank you, Saifi. Thanks, Siman. Thanks everyone for joining.